Okay, so maybe I'll just mention about that. So we're going to get started. It's 10 o'clock. We have just enabled live transcription. So you can, the trick with Zoom, as you guys probably know, is you have to save it as you go, because once the meeting ends, the transcript will be gone. So if you click on the little button at the bottom for a live transcript, that'll bring up a window. And then at the bottom of that window, there's a little button that says Save Transcript, and it'll save it as a text file to your computer. And in terms of the other logistics about the content, which of course everyone always asks, about slides, there will be a slide deck. It will be posted to our LinkedIn group, which you can find by just going on LinkedIn and searching for BSA Access Committee. And then myself or one of the other co-moderators will be happy to let you in, and that will be done as a post, probably a few days, excuse me, after the event. The other place this will be is the video of it, which is being recorded now, will be at the webpage of the BSA Access Committee. So I think you can actually just Google BSA Access Committee, and at least that works for me, although maybe my algorithms are different. So if you go to architects.org, which is the BSA website, there's a bar at the top and you click on Knowledge Communities and you can find us that way too. That's where the YouTube video of this will go. So you should be covered. Okay, and then just to get started, some housekeeping on this first slide. The captions and the transcript I already mentioned. It is being transcripted. We're going to be doing questions via the chat, and Kathy's going to moderate that. So if you have a question, you can chat it to everyone. You could also chat it directly to Kathy. Just be sure to label it as a question and she'll read them out during the Q&A period. And also, of course, make sure your audio is muted. Okay, go to the next slide. Okay, so this is a co-presentation with ICHD and my organization, which is the Access Committee of the Boston Society for Architecture. Myself and Josh Safdie are co-chairs of that. So this has been submitted to the AIA for continuing education credits. There'll be 1.5 health, safety, and welfare credits, and these are the learning objectives. After finishing the program, participants will be able to design multifamily housing to comply with federal and state accessibility requirements, determine which laws and regulations apply in particular situations, differentiate different requirements for new construction, additions, and alterations, contact the appropriate agency for clarification. And we will be putting into the chat a link for a Google form. And if you are an AIA member, all you have to do is fill out your name and your AIA number. That will be sent automatically to the BSA, and you'll get your continuing education credits that way. If you need a certificate, let us know, because that's a separate process. Okay, so I am going to hand this over to Kathy, who put this program together to get started. And again, this is Multifamily Housing and Accessibility, Untangling the Confusion, Part 1. We'll do Part 2 at exactly this time next week. So Kathy, if you would, please take it away.
Thanks, Ian. Good morning, everybody. I'm Kathy Gibbs. I'm the Director of Training at the New England ADA Center. And I think I've met many of you either at ABX workshops or over the phone. I'm really delighted to have this panel of experts to talk about this very confusing topic, which is accessibility requirements in multifamily housing. We have Debbie Ryan, who is an accessibility specialist and has accompanied Deborah A. Ryan Associates. She was the executive director of the Mass Architectural Access Board for many, many years, and she helped write the current regulations, which are 2006. We have Rex Pace, who's the senior advisor for accessible design at the U.S. Department of Housing and Urban Development. He's going to be talking about Fair Housing Act requirements and Section 504 requirements. And then Dave Yanchuis, who's been a frequent presenter at ABX. He's the director of the Office of Technical and Information Services at the U.S. Access Board. And again, I want to thank the BSA Access Committee, Ian, Josh, the whole crew for co-sponsoring the event. So just a little bit about the ADA Center. When Congress passed the ADA, I think they decided it was sufficiently confusing that they had to provide some technical assistance. We're funded by the federal government. There are 10 of us. If you contact any of the centers, you would be calling the 800 number, 800-949-4232. It works by area code. So decades ago, it worked really well when we didn't have cell phones and we weren't moving all over the country. So if you have a 617 area code, you will get us no matter where you're calling from in the country. If you moved from California and you have whatever their area code is and you're calling about Massachusetts questions, you'll actually get the Pacific ADA Center, but we all know each other. And so they will transmit you to us. We're not an enforcement agency. We are trying to get voluntary compliance with the ADA, explain what it is. We work a lot on architectural access issues, but we also cover everything. Employment, transportation. We've been getting a lot of questions about COVID-19, employment issues. So sort of the whole ball of wax. And yes, the slides will be available afterwards. As Ian said, they will be posted on the BSA's website, but also you can email me directly. And if I can figure out how to go back. Oh, no, that will be at the end. We'll have all of our contact information at the end. The New England ADA Center is a project of this wonderful nonprofit organization, which many of you are familiar with, called the Institute for Human-Centered Design. So we go beyond legal requirements and really try to figure out what is the best design for a variety of people. I think some of you have been to our beautiful office at 200 Portland Street. We've held a lot of events there. And unfortunately, we are going to be moving. We're all going to be working from home, and we will have a much smaller office downtown Crossing. But we're going to continue to be operating full speed. I don't know if any of you participate in our lunch and learns, which are now kind of eat lunch wherever you are and learn, but do sign up if you're interested. Go to our website and you can sign up to be on our mailing list. So what's confusing about accessibility requirements in multifamily housing? Basically, it's because there are 4 laws. Massachusetts still has its unique architectural access requirements. We're probably the only state in the country that has its own unique requirements. Most states have adopted the International Building Code, which has Chapter 11, which is on accessibility, or they've adopted the ADA standards or something. But we have our own unique regulations. And then there's the Federal Fair Housing Act. There's Section 504 of the Rehabilitation Act, which kicks in if you're getting federal funds. Excuse me. And there's Americans with Disabilities Act, and we will be explaining all of these. Just to kind of get a kind of cognitive map of where we're heading, there are 2 types of mobility accessible dwelling units. And the first are called, they're either called Maab, that's Maab Architectural Access Board, Group 1, Fair Housing Act. And these apply to many units, but they're less accessible. So I think the idea for these was kind of more aging in place. It's not really a unit that's good for somebody who uses a wheelchair all the time, someone with paraplegia who had a stroke, who can't walk at all. But they're going to really work for a lot of people, either if they have surgery and come home and they're using a walker or crutches, or as we age. The second type of mobility accessible unit, which is Group 2, Maab, the ADA in Section 504, applies to fewer units, so 5% of the units. And they are more accessible. And these are the units that really work for somebody who has paraplegia or quadriplegia or had a stroke and does not get out of their wheelchair. They have to transfer but they can't stand. So just to give you a little sense of this, and we'll be going over the design requirements next week on the 26th. But just to see on the left, the Maab Group 1 for housing doesn't have a turning space. There's some wheelchair spaces at particular elements, but you know, if you can't get out of your wheelchair, this is really not going to work. The ones on the right, the design on the right, which is the Group 2 and the AD and the Section 504, much bigger. And that's going to apply, as I said, to the, you know, to the 5%. Same with the kitchen, the smaller ones, there's requirements for clear floor space at particular appliances, but there's not a requirement for a turning space. So the other ones are going to be larger. So that's just going to give you a little overview kind of what we're talking about with the two kinds of mobility accessible units. So today is on scoping, it's not on design. And what we're talking about is what laws and standards apply and what types of units are required. And it's really important to figure this out, because if you're not in the right law and you're not in the right standards, you're lost from the beginning. When people contact us, these are all the questions that we ask. Who owns it? Is it private or is it state or local government? How many units? Is it new construction? Is it an alteration or is it an addition? If it's an alteration, what is the cost of the alteration? If it's an alteration, what is the equalized assessed value of the building? So Debbie will get into this. Is it receiving federal financial assistance? Is there an elevator in the building? Are units single-story flats or multi-story? If they're multi-story units, is there an internal elevator or designed for a later installation of an elevator? So these are all the things that are going to help you figure out, well, which law, which regulation, which standards should I be in? And I'm going to turn it over to Debbie to talk about the Mass Architectural Access Board. So Deb, you're on.
Thanks, Kathy. Welcome, everyone. So what I'm going to do is give you a little background on the State Access Board. So the Architectural Access Board was basically started in 1968. And at that time, it was called the Board to Facilitate the Use of Public Buildings by the Physically Handicapped. It was a small board with a set of regulations that were only 10 pages long. And those regulations only applied to city, state, and town-owned facilities. And in 1975, it was changed to the Architectural Barriers Board. And Mass General Laws, Chapter 22, Section 13A, established the board. And it has had some changes over the years. It was originally a 7-member board. It is now a 9-member board. There are 6 members who are appointed by the governor, and there are 3 designees from state agencies: the Secretary of Elder Affairs, Director of Office on Disability, and the Secretary of Office of Housing and Economic Development. Those are the 3 designees. And again, 6 members appointed by the governor. Mass General Laws 2213A is what gives the board its authority to promulgate regulations for accessibility, and basically sets out the guidelines of what they have authority over. Next slide, Kel. Cap, next slide. Oh, there we go. 521 CMR is the rules. 521 CMR means Commonwealth of Mass Regulations. So these are the rules and regulations of the AAB. The most current version has an effective date of January 26, 2006. The difference with Massachusetts is this is actually a building code. It is not a civil rights law. It's a building code incorporated by reference into the Mass State Building Code. It's the substitution for Chapter 11. It's enforced by the local building officials, local and state building officials, as well as the AAB itself. So for housing, there are basically 2 types of unit. Kathy mentioned this a minute ago. For the AAB, they are called Group 1 and Group 2. Group 1 are similar to FHA. They provide minimal accessibility, and it applies to a whole bunch of units. And Group 2, for those of you who have been doing this for a long time, are the old 5% accessible units. which do not need grab bars and things like that at initial construction. So it applies only to a limited amount of units, just 5%, but it requires bigger kitchens and bigger bathrooms. So for the requirement of a group 1 unit, it applies to new construction, and it applies to new construction of multiple dwellings that have 3 or more units in a building. If there are 3 or more units in a building, all ground floor units need to meet the requirements specified in group 1. All ground floor units in a building without an elevator, or if your building has an elevator, all of the units are covered. Again, there are minimal accessibility requirements like 32-inch clear opening and doors, and clear floor spaces at fixtures at bathrooms and kitchens. Under group 1, townhouses are exempt. Under what defines a ground level unit? So for multiple dwellings with a garage or commercial space at grade, the first floor of dwelling units above the garage or commercial space will be considered the ground floor. This happens a lot down in Boston, where you have a 3-unit, the old triple decker, where you have parking on the ground floor and you have 3 units above that. The ground floor will be technically the 2nd floor, and access must be provided up to that level. When you're dealing with additions, group 1 units will be required if it's new construction portion of existing multiple dwellings. So if, for an example, you have an existing multiple dwelling that has 10 units and it was built in the 80s, and you're adding a 2-story addition with a total of 10 units, 5 on the ground floor and 5 on the 2nd, and no elevator is being provided, the 5 units on the ground floor are covered, and they must meet the requirements of group 2. The existing units are not covered, and the units on the 2nd floor are not covered. If it's the same building and you have no units on the ground floor, and you're adding 5 units on the 2nd and 5 units on the 3rd, and you don't have an elevator, you are required to either provide a group 1 unit on the ground floor, or vertical access to the 2nd floor must be provided. 2nd floor being the first level of housing.
That's let me make sure I'm going in the right direction. Oh, there we go. Okay, so that's the end of the MAB group 1 portion. Moving on to Rex, if you want to unmute and vision yourself, you also need to unmute, and we'll go ahead with the Federal Fair Housing Act.
Hello, everybody. I'm Rex, and it's great to be here today. And I'm going to talk about fair housing, and a lot of this is going to be similar to what Debbie just told us for the state code. And it's Fair Housing Act is very broad. It applies to lots of different types of housing, both public and private, things like apartments, multifamily housing. You typically think of like apartments, condos, co-ops. It can also address some things where there's actually some overlap with things that may be covered under the ADA, such as dormitories at a university, homeless shelters. So it has a pretty broad reach. And of course, I'm with the U.S. Department of Housing and Urban Development, and we write the regulations for the fair housing and do much of the enforcement. Let's look at the next slide. It's very similar to Massachusetts, except we have slightly more units. We have 4 more units as opposed to 3 or more. And again, it's going to be all units in an elevator building. And if it's not an elevator building, it will be, typically it will be just a single floor. It will be the single story units on the ground level. There are some instances where multi-story units can be covered to a degree. It depends on the elevator. We'll talk a little bit more about that in a few slides. So next slide, please. So when I say a single story unit, it really literally for the most part means that in this diagram here, we see the shaded unit in the kind of right off the center there of the drawing. And that is a 1-story unit. If it's a 2-story unit like the townhomes to the right in this image, then they would not be covered. Again, unless we have elevator issues, which we'll talk about. And then to the left, we have an example of a unit that has a basement, but that basement is finished with living space below the main floor. So that's really a two-story unit. If that were an unfinished basement, it would probably be considered a single-story unit. Let's go to the next slide, please. Okay, so when we have a building that has an elevator, like I said, all the units were covered. If that's a common use elevator, and we have a two-story townhouse style unit, say within that building, that you're accessing from the common use elevator, then the primary entry floor would be covered, not the entire unit, but the floor that you enter on from the common use area or the primary entrance would be covered. So let's go to the next slide, please. If you have townhome units which have an elevator internally to those individual units, and we're talking about here something that's presumably higher end and probably not as common, but if it has an internal elevator either provided in it or it has the option where you could have an elevator like has a shaft in it that you could install a residential elevator in at a later date, then that entire unit would be covered under the fair housing. Again, if it's in a development of 4 or more units. So let's go to the next slide, please. So when I say 4 or more units, I'm talking in terms of a structure, right? The structure has to be what we call structurally joined buildings. And that's really, when I say structurally joined, then we're not really talking about the column grid or something like that. We're actually talking about they physically attached to each other, either by a canopy or a shared stairwell. In this image here at the top of the slide, we have what you might consider to be 2 separate buildings with 3 units, but because they share a stairway, an exit stair, entry stair, then it becomes a 6-unit building that's covered by the fair housing. Likewise, a building can have firewalls, and those firewalls do not make them distinct buildings on the purposes of fair housing. We would look at in the example here at the bottom of the slide where we have 4 units are separated by firewalls, that's still going to be covered by fair housing. Actually, in this case, it's 8 units because each story is a single unit dwelling. So let's go to the next slide, please. So again, we have a similar situation to we have in the Massachusetts requirement, in that if we have single-story units that are over retail shops, like we have in a lot of redevelopment urban areas, we'll have a commercial floor on the bottom of the building, then you consider the first floor above that that has the single story units to be the ground floor. Likewise for a common use garage, in the image we see below. Let's go to the next slide. Now, you don't have multiple ground floors necessarily because of the design of this issue. If you, for instance, if you had a building that was split between, single story units that were at grade, and then you had another series of single story units that were over a common use garage, you would only consider those units at grade to be the ground floor. You wouldn't create another ground floor by raising the units up over the common use garage or retail spaces. So you're not necessarily required to have more than one level at grade. There are instances where literally because of the sloping site, you might have multiple ground floor levels, but you will only have that because of the grade. You will not have it because you're raising other units over spaces if you have others that are at grade. So hopefully that made sense. Let's go to the next slide. So what is an elevator building? You do want to be careful about this. In the example on the left, we have an elevator that goes up to 2 of the floors, and you would walk up to the rest of the units. And that's not really, that would still be an elevator building and would be completely covered by the fair housing. Once you go beyond the ground floor level with an elevator, then it's an elevator building. So what you really have to do is what's shown on the right here, the elevator would have to go to all the units. Let's go to the next slide. There is a little bit of a allowance, so to speak. If you had an elevator that was going between garage levels, going from like a lower garage level that's buried underneath the structure, and would go up to the first floor, that does not create an elevator building. That's okay. That doesn't turn your building into an elevator building. You could still have the floors above the grade not covered, not comply. So let's go to the next slide. And that takes us to the end of fair housing. And I guess we'll take it back up with Debbie.
Okay, great. Thanks, Rex. So we're going to switch to the AAB's requirements, scoping requirements for Group 2 units, which there's a lot of questions you need to ask in order to find out whether you need to have a Group 2 unit. So Group 2 units apply to new construction, reconstruction, alteration. It applies for those developments that have units that are for rent, hire, but does not include units for sale. So condominiums that are owner occupied are not covered under the Group 2 requirements. There has to be 20 or more units in the complex or project. It's not a per building requirement. So you could have 2 10-unit buildings and they would be covered. You are required to provide 5% of the total amount of units in the complex or project, and they are required to be mobility accessible. These, for people who have been doing this for a long time, these are the old 5% accessible units. Additionally, 2% are required for people who are deaf or hard of hearing. The units, the 5% of the units must be proportionately distributed according to bedroom size, quality, price, location. And in this instance, townhouses are not exempt from the 5% requirement. So if you have a total of 20 townhouses that are all rental units, 5% need to be accessible. Next slide. So there are a couple of exceptions for townhouses in the Group 2 requirements. So you can substitute an accessible flat that's of comparable size and amenities and et cetera. So if you have a 3-bedroom townhouse, you can substitute a 3-bedroom flat as long as it has its comparable size and has the same amenities. Or you can provide the future installation, provide space in the unit for the future installation of a wheelchair lift or a residential elevator. So if you design a townhouse unit and you can stack space in the unit for a lift or an elevator, it does not mean just drawing a box on the plan and that box happens to, penetrate the middle of the kitchen. You actually have to design space so that a lift or an elevator could be provided in the future. Next slide. When it comes to an addition, if the cost of the addition is more than 30% of the assessed value of the building, and the assessed value is the assessed value at the time the permit is pulled, and it's the building only, and it does not include the land. If it is more than 30%, then full compliance will be required. It's similar to new construction, but it does not trigger Group 1 for the existing. It will trigger Group 1 in the addition, but not for the existing. So if you have, 30 units and you're putting on 10 more units, the 10 additional units need to meet Group 1. But if those 10 units, the cost of that addition is more than 30% of the assessed value, it will trigger 5% of Group 2. You'd have to add the units in the existing building and the addition to determine how many Group 2 units you need. Next slide. If you're doing reconstruction or alteration, the work must be more than 30% of the assessed value in order to trigger the requirement for 5%, the Group 2 units. It has to be more than 30%. So if you are working on an existing unit, you're doing the kitchen and bath renovation, and you're not spending more than 30% of the assessed value of the building, you are not required to make it accessible. And this is a cumulative money thing. So if you're spending more than 30% in a 3-year period, that's where the requirement comes in. If the work is being performed on the units and is less than 30%, there's no requirement. However, if you're doing any work to any public and common use space, that work must comply. So if you're working on the community building and you're renovating the entrance or the bathroom, those must be accessible, but it's not going to trigger anything else. You have to be spending more than 30%. Next slide. Enforcement of the AAB, the board itself has the authority of local and state building officials and the enforcement of its regs. Local and state building officials obviously have the authority to enforce. And the board also has the ability to impose fines of up to $1,000 per day for willful noncompliance. A hearing needs to be held to determine whether or not your noncompliance is willful and deliberate, and if so, the board has the authority to impose fines of up to $1,000 a day. Next slide. That's the end of group
Deb.
2.
Thanks, Deb. That was
Yep.
great. Rex, moving on to you to talk about Section 504 of the Rehabilitation Act.
Okay, great. All right, so it's me again. Let's talk about the Rehabilitation Act of 1973, which really is a comprehensive non-discrimination act. It covers employment and procurement of technology, a lot of things that revolve around the federal government. I'm going to focus today on basically the design and construction obligations for housing. So our regulations at 24 Code of Federal Registers, Part 8 and 9. You care about Part 8, that covers you as a recipient. 9 is the agency's obligation. We have very specific requirements for design and construction and what we expect. So you really do need to look at those requirements, and I have a link which I can give out if people need a reference to them. One of the things you need to remember about the Rehabilitation Act is that most every agency promulgates its own regulations and does its own monitoring, its own compliance, it's responsible for the enforcement. So there can be a lot of variety between federal agencies and what's required. So remember, I'm talking specifically about HUD's requirement. If you're doing a facility that has overlap, which you probably won't in the terms of housing, but it is possible. You might be working on a community center or something that has commercial spaces that are being under GSA, General Services Administration's purview. You might have overlap with some differing requirements. You do need to look toward each agency you're working with. Again, I'm focusing on HUD's requirements today. Let's go to the next slide. So HUD has, and we'll get into this a little bit more, HUD has different requirements for, we still officially in our regulations, refer to the Uniform Federal Accessibility Standards, or UFAS, for our new construction requirements, but we have developed an option where people can use the 2010 ADA standards if you do the more stringent requirements of UFAS in Section 504. We'll talk more about this in the technical section, but you do have an option because many of you will have an obligation to 2010, and we're aware of that, and we have put it on a notice of how you can use that as an alternative accessibility standard. Let's go to the next slide. So first off, who is a recipient? We interpret recipient of financial federal assistance very broadly, virtually any form of financial assistance, and that can include the gift of property. There are some things that are not covered. For instance, guarantee of insurance is really not something that it would be considered financial assistance. So there are some very broad items that we would exclude. But for the most part, if you're getting money from HUD, you will have obligations to the Rehabilitation Act, and in particular Section 504. So this could be things like funding to public housing agencies, community development block grants. I'm sure a lot of you are familiar with that. The Home Investment Partnerships Program, which encourages home ownership. Obviously, our programs dealing with supportive housing for the elderly or supportive housing for people with disabilities, they'll for surely have these obligations. So our requirements cover a lot of different entities, state, local governments, agencies, nonprofits. Private entities can have requirements, and they may very well be more stringent than your obligations to other things you're mandated to comply with. Let's go to the next slide. So the kind of things that Section 504, requirements that affect construction, of course, obviously, anything you build new or you do alterations to will have requirements, but you may also have existing projects that you may not be planning to touch, and there could very well be program access requirements that would obligate you to make changes to those too. So this is not just a new construction and alteration requirements, although that's what I'm going to focus on today. We have many requirements that that require that the accessible units be distributed throughout a project by type and size. So we want dispersion, so to speak. We also have requirements that affect, how you advertise and rent out the units to, or sell units to individuals with disabilities. And we also do monitoring of who receives our grants. We do compliance reviews. We do check into what people are doing and do request that people report in on their activities of how they're making their developments accessible. Let's go to the next slide. So when do the new construction requirements kick in under Section 504? Well, we require them for multifamily housing, which we define as 5 or more units. So remember, this is when the new construction requirements would kick in if you're building a project. Now, that's not really a site limitation, that's really under one contract. So you could be doing multiple units scattered between different sites, and that would meet the 5 or more unit requirement, and it would be covered. All non-housing facilities that you build must comply. Common use areas or community centers, they will need to be accessible. And remember that everything is covered by our program access requirements, regardless of the number of units. So you may be going to a community and you decide to build a, maybe infill project. You're going to do a duplex in a community. Technically, if that's the scope of the project, it doesn't fall under our new construction requirements. But you would still need to evaluate, things in terms of program access. Maybe you don't have any accessible units in the area of that area of the city, or you haven't built accessible units in other projects for a while in that area, then maybe this would be the time to do it. Let's go to the next slide, please. In terms of the number of units we required, again, it's going to be similar to some of the other legislation we're speaking to today. 5% of the units must be fully accessible to people with mobility impairments, or rather, these in essence are mobility accessible units. And then an additional 2% of the units must be accessible to people with hearing and vision disabilities, which are referred to in some of the other standards as communications accessible units, and it's essentially the same as those. HUD can prescribe a higher percentage of units depending on a situation where there's discriminated need because of the population in a given area. Although oftentimes we do this because we're in a settlement or an agreement with a housing provider where they failed to provide enough housing in the past, so we make them provide more housing in their future projects. Let's go to the next slide, please. So that was new construction. What do you do in regard to alterations? So you need to be careful. You really do have to look at the regulations to understand what we expect in regard to alterations, because it is distinct from what you might see in an accessibility standard. So first off, we have a requirement for what we call substantial alterations, where if you make a substantial alteration, it has to meet new construction requirements, not alterations. There are some major stipulations on this, however. First off, it has to be a project with 15 or more units, and you have to be renovating the project to the extent that it equals 75% of the replacement cost of the completed facility, which is a really high standard. You're essentially stripping down a building to its structure, to its floors and the support columns, and rebuilding it. So it is like a new construction situation. Everything else falls under other alterations. And you want to be a little careful, and this is more typical of what you think in terms of the alterations being considered in terms of their scope and their intent. Although you need to be careful that if you do a series of small alterations, that may amount to a major alteration, and then you would have to, for instance, you might be doing a series of secondary alterations to a unit, but considered collectively, this may mean the unit needs to be entirely upgraded to be accessible. So it's very similar to some of the requirements you'll find in the ADA. The big thing that I would say about alterations is you'll hear talk today of percentages in regard of costs you're spending. I would say that under Section 504, the standard for when you don't make an alteration accessible is higher than a lot of the other standards, because really you're required to make your alterations accessible to the maximum extent feasible. And what that means is that it does not impose an undue financial or administrative burden, which could be higher than other alteration situations in regard to the ADA or some state codes. Let's go to the next slide, please. So I'm going to talk about both fair housing and Section 5 enforcement, and I'll just touch on this briefly. Of course, you know, the HUD does a lot of enforcement activities. We have a tendency to work toward, if we can, voluntary agreements and certain types of consensus, if we can. However, we do have other mechanisms for legal action. But we're not the only one who enforces these laws. Primarily, we're one of the main forces, but the Department of Justice also is involved in trial cases around both of these acts and setting precedent. Additionally, state and local fair housing enforcement agencies, you know, undertake their own activities to ensure compliance. We fund many local and state organizations to promote fair housing. And one of the great things about many of the acts we're talking about today in terms of like the ADA and fair housing and Section 504 is it empowers individuals to go to court in defense of their civil rights independently. So you can have private lawsuits in federal court and state court, and that's an important thing, and that can also be an issue. In regard to non-compliance, we do require people to retrofit, which can be significantly more expensive than doing the accessibility to begin with. People who have been subject to discrimination can receive damage awards, punitive damages in federal court, and there are civil penalties around not complying. So so you do need to take this seriously. There are consequences for not complying, and people do complain, and we do have settlements, and there are court cases, and you can go on our website and see more about that. So on that note, we'll wrap up 504 and we'll proceed to the next section.
Thanks very much, Rex. So I just wanted to mention, you know, most of the money that comes to the state for housing is from HUD, but we do have money from rural development from the Department of Agriculture. So I just kind of wanted to mention those requirements. They have a regulation, non-discrimination on the basis of handicap. Handicap is the word that was used for many decades, and we no longer use the word handicap. We talk about people with disabilities, but all of these regulations were written, I think, in the 70s and 80s, and they haven't been updated. Unlike HUD, the HUD regulations have that very specific section on housing, which talks about the 2% and the 5%. The Department of Agriculture regulations do not have a section on housing. What they do is they talk about using the Uniform Federal Accessibility Standards as the standard for compliance with 504, and the Uniform Federal Accessibility Standards requires that 5% be mobility accessible. So you could sort of end up in the same place. And then we're looking to UFAS for alterations because, again, we don't have that information in the Department of Agriculture Rural Development regulations. And substantial alteration is considered 50% or more of the full and fair cash value of the building. That's treated as new construction. So it's a lower standard than the 504 regulations, which I believe were 75%. And then they talk about structural impracticability, or if something is structurally impracticable. That's a substantial alteration. Other alterations, if alterations of single elements when considered together amount to an alteration of a space or building, then the entire space shall be made accessible, except to the extent where it's structurally impracticable. So that is really the rural development or the Department of Agriculture regulations. Again, you have to find out, is that a source of money? I mean, one of the things I find architects do not know is whether or not the project they're working on is receiving federal financial assistance. And if it is receiving federal financial assistance, who is that federal financial assistance from? Is it from HUD? Is it from rural development? There may be other sources, but that becomes really important in terms of understanding what your obligations are. So these are just some of the rural development money sources: housing loan guarantees, multifamily housing rental assistance. You can find the rural housing programs at this website, rd.ms.gov. usda.gov multifamily. And we have resources pages that has all of the information that we're talking about in terms of links. So you don't have to write down all of these links. So that was a little whiz through 504. And now I'm going to turn things over to Dave to talk about the Americans with Disabilities Act.
Thank you, Kathy. And we're going to move now to discuss the last law on the agenda for this session, the Americans with Disabilities Act of 1990, which does cover multifamily housing in the public sectors, and not so much the coverage of housing in the private sector is more circumscribed. And reasons for that is that the ADA, when the ADA passed, the Fair Housing Act was already on the books. So the ADA is really focused in the private sector and covering public accommodations and non-residential facilities. Also, there's a considerable overlap of coverage with the Rehabilitation Act in the type of housing covered, and we're going to talk about that a little bit further. But it's important to keep in mind in determining whether the ADA applies to housing is whether or not it's owned or operated by a state or local government. Because the ADA broadly covers state and local government facilities under Title II of that act. Now, in the private sector, the ADA is coverage in terms of facilities is limited to places of public accommodation and commercial facilities. So we're going to talk a little bit more about what that means, because that's usually key in determining whether a type of facility in the private sector is in fact covered by the ADA. Now, the ADA's regulations and standards are issued by the Department of Justice, and those applicable to state and local governments, including housing, are found at 28 CFR Part 35. They're also referred to as the Title II regulation. And the private sector facilities, places of public accommodation, and commercial facilities are covered by regulations at 28 CFR Part 36, referred to often as the Title III regulation. Now, in addition to what the scope of this coverage, keep in mind that there's two major exemptions in the ADA. One is for religious facilities. So any facilities owned, operated by religious entity are exempt. And that exemption, which is modeled after prior federal civil rights legislation, is pretty broad. So it includes not only places of worship, but other facilities owned, operated by religious facilities used for other purposes, whether it's for education, including schools, or housing would be exempt. And there's also an exemption for entities that are considered a, quote, private club. Next slide. So let's look a little bit more in terms of Title II and the ADA's coverage of state and local governments. This, again, is pretty broad coverage. ADA is applying to any facility constructed or altered by, on behalf of, or for the use of a state or local government entity. And this would include housing, including public housing, housing at places of education, such as state colleges and universities, various types of social service establishments, which are providing residential programs and services, including homeless shelters, halfway houses, group homes operated by a city or other state or local government, and employee housing. So a big difference here between ADA Title II and what Rex spoke of earlier about the Rehabilitation Act is simply that the ADA is requiring compliance irrespective of any federal financial assistance. So, for example, whereas the Rehab Act is going to apply and is really tied to federal funding, the ADA's coverage of state and local government programs and services and facilities is not tied to any kind of federal financial support. As a result of that, there is especially in the realm of housing, there's a considerable degree of overlap between the ADA and housing owned and operated by state or local governments, because so many of them receive financial assistance that is triggering also Section 504 of the Rehab Act. Next slide. Now, in the private sector, as I noted, the coverage of housing is much more limited. Again, because the ADA was cognizant of the Fair Housing Act already being in effect in part. So when we look at whether a facility that is residential nature is covered in the private sector, we basically have to look and say, does it function in a way as a place of public accommodation? And this is a very detailed, inclusive list in the definition of public accommodation in the law and the regulations that stipulates 12 categories of facility type. And for one to be considered a place of public accommodation under the ADA, that facility basically has to fall into one of these dozen categories. So really, in making this determination, the facility must be operated by a private entity whose operations affect commerce and is either one of the following: a place of lodging, like hotel, motel, dormitory, restaurants, and cafeterias, and other establishments serving food and drink, including bars, a place of exhibition or entertainment, like a theater or a museum, place of public gathering, like convention centers and arenas, a sales or rental establishment, a service establishment used for providing transit stations for specified public transportation, places of public display or collection, places of recreation or education, social service establishments, or places of exercise or recreation. So this is really what we have to look and see whether a facility is covered that is residential in nature in the private sector under the ADA. For example, most often we will look to see whether the facility in question is, in most cases, either a social service establishment, and it providing sufficient level of social services that makes it count as a place of public accommodation. Next slide. Now, when we consider that the facility has to function as a place of public accommodation, the most common examples of facilities covered as housing in the private sector under Title III would be housing at places of education like private colleges and universities, or portions of other facilities like condos or apartment buildings with a sales or rental office. So a lot of times you could have a mixed use where only a portion of a building is covered as a public accommodation, like a sales or rental office, but the remainder, including the residential units, would not be covered. Also, if you have public accommodations like stores, restaurants, hotels within an otherwise residential building, that portion would also be covered. So sometimes when you see these combination condominium building with residential units and also transient lodging hotel accommodations, then the ADA would cover those functioning as transient lodging, but not the residential. And as I noted, those that have a sufficient level of social service provided will then likely make them covered as a social service establishment. And that would, some of the things looked at would be the types of services provided, including counseling, training, medical care, and similar social services. Next slide. Now, the implementing regulations under Title III in further addressing private housing note that the provisions for dwelling units apply to, including residential, apply to social service establishments providing sleeping accommodations or residential dwelling units. And what this stipulation in the regulations is saying is that for these kind of social service establishments, when covered because they are considered public accommodation, you are to follow the residential scoping, not transient lodging. The other thing these regulations clarify is specific to housing at places of education. Now here, so let's say we're talking about dormitories at a private college or university. Most dormitory housing on a campus is going to be treated as transient lodging, meaning the requirements that apply for more shorter term housing. However, the type of housing on a campus that is treated and subject to the residential facility requirements would be apartment or townhouses leased on a year-round basis for graduate students and faculty exclusively, provided that they don't contain any public or common use areas for educational programming. So these stipulations in the Title III regulations are basically clarifying when you follow the sections of the standards that speak to residential dwelling units versus those that are applicable to what we call transient lodging. Next slide. Now, again, so based on what we looked at in terms of places of public accommodation, then a lot of housing in the private sector is not going to be captured by the ADA, and that would include single family homes. It includes multifamily housing, either condominiums that are owned or apartments and other residential units that are leased. Now, again, like we saw before with sales or rental offices, you can have some portions of a residential facility covered if they function as a place of public accommodation. So this could mean something like a gym, swimming pool, meeting rooms, and other amenities. But keep in mind that these type of spaces are not covered by the ADA if they're only available to residents and their guests. In order for something like an amenity like a gym or pool to be considered a public accommodation, it basically has to be available to the general public. So if an apartment or condominium offers memberships to non-residents to the general public, then that would be covered under the ADA as a place of public accommodation. But if it's something that only residents and their guests can use, then it's typically not going to be considered a public accommodation. Next slide. So the standards that are implemented under the ADA date to 2010, the date by which they were adopted by the Department of Justice. And they are, when a facility is built, altered, or added, then the standards apply to that activity. So the standards are not really applicable to existing facilities unaltered, but instead apply specifically to new construction, additions, and alterations. Next slide. Now, one of the things we want to look at in the standards is the fact that it includes a definition of residential dwelling unit. And so when we're looking at the standards applying to a facility that's residential in nature under the ADA, we're looking at that unit and the requirements for residential units as being applicable to that functions as a residence and is primarily long-term in nature. And we're defining it this way so that to help people, besides some of the clarification we saw in the regulations from DOJ, is really trying to make and help users determine what sections of the standards should apply as a residential unit versus those sections in the standards that are specific to transient lodging, which is sleeping accommodations used on a short-term basis, more or less, or inpatient medical care, inpatient bedrooms, or licensed long-term care, or detention and correctional facilities. So we're really defining these terms in the standards to be mutually exclusive. So if you have a transit lodging or a medical or long-term care facility, that by definition is not going to be covered as a residential unit for purposes of the standards and which sections to follow. Next slide. So one key factor here that we see in the residential section of the ADA standards is this recognition that so much of housing covered under the ADA is also going to be subject to the Rehabilitation Act. Again, because we're looking at most housing being this covered in the public realm, state and local government, which is often the recipient of HUD funding. So we often see a lot of overlap. In light of that, the ADA standards basically stipulate that if your residential facility is subject to Section 504, then you are held to HUD's 504 regulations for scoping. And that's really, going back to what Rex covered in terms of at least 5% of the units being mobility accessible, and an additional 2% being acceptable to persons with hearing or vision impairments, or what are typically referred to as the communication accessible units. Again, this scoping is applying to projects of 5 or more units, and it's, as Rex noted, may be higher based on need in certain situations. So this is one where we try not to really reinvent any wheels. So if you're covered by the ADA and also the Rehab Act, then your housing is only held to the scoping, the minimum number unit requirements stipulated in the 504 regulations. Next slide. If a facility is not subject to 504, then we're implementing in the ADA standards very similar scoping levels, 5% mobility accessible, including and that are on an accessible route, and 2% communication accessible. Now, this requirement would apply even if you have 1 unit. And then we also pick up similar language in the 504 regulations that allow you to apply the minimum number to 15 or fewer dwelling units that are developed under a single contract or developed as a whole, whether or not located on a site. So this is one of the areas where so often the ADA standards are really looking and applying site by site. But when you have facilities with 15 or fewer dwelling units, we allow you to combine them if they're developed together or under a single contract across multiple sites for purposes of applying the 5% and 2%. They're still covered, but it's just allowing you to base the 5%, 2% on the total of those developed as a whole under a single contract. Next slide. We also have requirements similar to those in the Rehab Act about dispersion of accessible units, so that there's a comparable degree of choice for residents with disabilities. If you have facilities with multi-story units, the ADA standards are also going to allow you to provide access to a 1-story unit, so long as it has equivalent spaces and amenities provided in the comparable to those in multi-story units. Next slide. When you are making additions to a residential facility covered by the ADA, then we are going to apply via the standards the 5% and 2% scoping levels to the total number of units added, not necessarily to the total located on the site. Next slide. In the case of alterations, we have, now again, this is facilities not subject to HUD Section 504 regulations. But if a building is vacated for an alteration, and that's excluding vacating a building for asbestos removal, then we're going to apply the 5% and 2% to the facilities if it has 15 or more units. Next slide. We also have a somewhat of a different framework in the ADA standards for determining what gets triggered in alterations to individual units as a quote unquote substantial alteration, where we saw, under the Rehab Act equations of 75%. Here we're looking at really not a cost relative to the value of the building, but instead we're looking at simply if you substantially alter a bathroom or kitchen and one other room in the unit, then that in and of itself triggers a requirement for the 5%, 2% to apply. Now, what we mean by substantial alteration with respect to a kitchen or bathroom is it's includes rearrangements in the plan or configuration or replacement of cabinetry, among other things. So this is somewhat of a judgment call, but we're really trying to capture alterations that are significant enough in their impact of the unit to bring in and make sure that the unit is fully accessible. Next slide. Also, there is provisions in the standard specific to units for sale. If state or local government is designing and constructing residential units for sale to individuals, the standards ensure that the appropriate minimum number are accessible both for mobility access and communication access. There is also requirements that where a state or local government housing program is going to sell units to pre-identified buyers, then it's important too that the accessible units be made available upon request of the purchaser. Next slide. Now, the ADA is enforced somewhat differently than what we saw under 504. It's modeled as a civil rights law, which also influences its enforcement regime. Under the ADA, one could file a complaint with the Department of Justice. Their other option is to file a suit in federal court. Next slide.
Okay, I think before we go on to resources, we're going to take questions. So Jason, anything in chat?
Yes.
Jason Angel, I just want to say Jason Angel is one of our great technical assistance specialists. Some of you may have talked to him, and he's going to be reviewing the chat questions. So go ahead, Jason.
Thank you, Kathy. Good morning. Our first question today is about multi-story units within a multifamily apartment rental building containing other single-story units with a common elevator serving all floors. Is that treated differently than a townhouse unit?
Deb, you want to take this under MAB first?
Sure. So under the AAB, the definition of a townhouse is a dwelling unit with finished living space on more than one story. So technically, those are exempt. I think the issue is more in FHA with a common elevator. I think Rex can handle that one.
Yeah, I apologize. I'm not quite getting the question.
Yeah, I want to say the question again, Jason.
Sure. So are multi-story units within a multifamily apartment rental building containing other single-story units with a common elevator serving all floors treated differently than townhouse units?
I think what the person is asking about is, so again, I would point back to the elevator examples we gave in the slideshow, in which you could have a common use elevator and have a multi-story unit, and you would be required to do the entry floor. And then units that have internally, individual units have an elevator, all floors would be covered. What you will see sometimes presently is you'll see apartment complexes that have townhomes on the bottom level. The townhomes will have entrances to the street, and then you'll go inside to a common use area, and you'll take elevator up to the multi-story units above it. I think you might be referring to that situation. And yes, even though those common use elevators aren't necessarily serving those multi-story townhome units, you would still have to make the first floor entry to those accessible. Does that help?
Could you question answer? Could you unmute yourself and maybe we get clarification on your question if we haven't answered it.
I think that takes care of it. Thank you.
Okay, good. All right, Jason, next question.
So our next question is directed at Rex. With regard to 504 compliance monitoring, can you speak to the notion of substantial compliance? If one grab bar in one bathroom is a ½ inch too high, for example, would the facility still be certified as compliant?
I think you have to look at that on a case-by-case basis. I mean, I think, in terms of a small mistake like that, it might be reasonable to see that as considered as substantially complete. However, I wouldn't necessarily take that as a general guide. I think you have to look at each situation, and we wouldn't commit to saying something like generally. We would say it is possible, but we decided on a case-by-case basis. What we don't want to have is a series of small discrepancies that came from inattention. We don't want to reward that. We want people to pay attention and implement the law as they're supposed to. Occasional mistakes, we understand.
Thank you.
Jason, next question.
Can you confirm if MAAB 521 CMR takes the same approach for housing at a place of education as the ADA? Are apartments or townhouse facilities that are provided by or on behalf of a place of education, which are leased on a year-round basis exclusively to grad student or faculty, subject to Section 9, multiple dwelling units of 521 CMR?
Yes, that's me. So dormitories would be considered transient lodging under 521. And I would say that student or faculty housing would be considered under Section 9, multiple dwellings.
Did we get your question answered? Okay. Jason, next question.
Is there a definition of transient which identifies a number of days stayed? Some leases may be by the month, for example, and not a standard 6 or 12-month lease.
Yeah, David, you want to talk about that first under ADA? And Deb, you should probably pick that up too, and Rex. So, but Dave, you want to go first?
Sure. For ADA purposes, the definition, including what's found in the standards, isn't based just as cleanly on a number of days. The definition of transient lodging refers to those that are used primarily short-term in nature, whereas a residential unit is those that are used as a residence and primarily long-term in nature. I would say typically when you're looking at something that's an apartment that you can lease out for, a year, maybe a little less than a year, it's not really tied to a specific length of time. But if it's really functioning where someone is going to use it as a residence, it's more off and it's in the private sector, then it'll typically not be covered under the ADA as strictly an apartment building, unless again it provides a significant level of social service. And so that's an important factor too, is that it's really not so much the length of, in the private sector, it's not so much the length of stay, but it being used as a residence and it having sufficient degree of social services provided.
And I would say with 521, it's pretty similar. There's no definition of how long you stay, but I think you'd have to take a look at it. Is it actually a residential, building, an apartment building, and month to month, or 6 month or 12 month? I don't think matters. It would still be a residential facility. I think the only difference is where it could be a transient lodging. Usually those are more on the resort side, so it really is case specific.
Rex, anything you want to?
Yeah, I would kind of reinforce a lot of what Debbie and David are saying. Sometimes you'll hear in terms of defining transient lodging, sometimes the month, the 30-day will be discussed. But I would be careful. I would look toward the particular legislation you would deal with. I would point out that HUD and some of our regulations, we define residence not so much in terms of time you're staying somewhere, but is that your primary place where you live? So, do you have anywhere else to go? You may not have anywhere else to go. And for you, a homeless shelter would be your residence because, that's primarily your only place you have to live. So we would look in some instances as that as being the residence.
Jason, next question.
All right. So 5% mobility and 2% communication are separate requirements. Is that correct? And then For senior housing, often the need is on both fields. One may be hearing and vision impaired, but also mobility impaired. It is a strange one needs to choose more things, limiting disability. So the idea is that often there's a need for more than one in maybe one situation, but 5% and 2% are considered separate requirements. Is that correct?
Deb?
Yeah, the 5% and 2% are actually separate requirements. I know the AAB is in the process of revising their regs, and if you feel that it should be in addition to, then you probably should recommend a change in the regs, but that's the current requirement.
And Rex for federally funded?
Yes, they are distinct, and I would say they're minimum 5% mobility, 2% communications. However, that doesn't mean you can't include communication features in the mobility units. They just couldn't count to your minimum of 2%. If you feel like that's a design need that you have, I'd encourage you to do it. Remember, these are just minimums, and if you feel like you're dealing with a population that needs both features in a unit, again, you can do that. But you would have to make it clear that there's 2% and 5% are met separately.
Dave, under ADA?
Yeah, very, very similar situation. And it's not as clearly stated in the standards, but we interpret it the same way as Rex says under 504.
Yeah,
Okay,
so
Jason?
just to touch again, you could do 7% of your units that have both mobility and communications features, and that would meet the requirement. I'm not saying you have to separate them, but if you want them to overlap, you probably will have to do more of one type of unit than the other.
Next question.
What is the definition of undue financial burden in HUD 504? And is there a rule of thumb like a percentage or cost?
I guess that's me. So no, I can't give you a rule of thumb necessarily because it's relative to the program. We do have some examples on our website. I don't know that they quite get at what you're speaking at, but no, there is no rule of thumb because it's relative to the program when it's considered in its entirety. Other than you would have to have some pretty significant impacts to claim costs as a factor.
Jason, next question.
Okay, can you discuss the applicability of 2A versus 2B units under 521 CMR?
Deb?
Sure. So 2A units are the units that have to comply when you have a multiple dwelling of 20 or more units. They are accessible units with the exception that they don't include grab bars at the toilet, grab bars in the shower or the tub. You can have base cabinets that are removable. So they're more adaptable to become fully accessible. A group 2B unit is, for example, in transient lodging, it is fully accessible at initial construction. So there's clear knee space under the sink, under the cooktop. Grab bars are installed at initial construction, grab bars in tubs, showers, shower seats. So group 2B is more in the transient lodging section and group 2A is more in multiple dwellings.
Thanks. Jason, next question.
If a development has multifamily apartments with over 20 units and a separate townhouse structure consisting of 8 units, do the townhouses need to be included as a part of the 5% group 2?
Simple answer is yes. When you're applying the group 2 requirements, you add all of the units in the entire complex or development to determine how many group 2 units you need. So in this case, you would have a total of 28 units and 5% of 28 would have to be group 2.
Next question.
Am I correct that houses of worship do not need to comply with the ADA, and this is true for MAAB? So any accommodation is optional?
Dave?
Well, again, as I noted, the ADA's exemption for religious entities is quite broad. So yes, any facility owned operated by religious entity is exempt. However, keep in mind that state and local codes, access codes, including access codes, may apply And Deb, if you want to talk about MAAB coverage.
Yeah, Deb.
Yeah, so it is not true that they do not apply with AAB. So as we stated in the beginning, the AAB is a building code, not a civil rights law. And therefore you have to meet all the building code requirements, and houses of worship are in fact covered.
Okay. Jason, next question.
What are the accessible parking requirements for a condominium development? Also, is a van accessible space required?
Deb, you want to start?
Yeah, so the AAB requires that residential spaces be capable of complying, but you do not need to provide signage indicating that it's an accessible space. Under FHA, I think that's different, and Rex can speak to that.
So given when the law was promulgated back in the 80s, it actually did not originally have a requirement for van spaces in the 1986 ANSI standard, which was referenced for the common use areas. Doesn't require van spaces. However, if you're using one of the other safe harbors, which we'll talk about tomorrow some more, or if you're doing a state code and you're using that to fulfill your the intent of fair housing, you may be required to do the van space. You want to be careful about that. The way you need to look at parking in terms of, first off, you need to think about the ADA some, in regard to, what part is a public accommodation, like the sales and service office, and you have obligations under the ADA to provide accessible parking there. We have to be van accessible. In terms of the residents, it's 2% of the parking spaces provided to serve the fair housing covered units. And then it would be, in addition, a reasonable number of visitor parking spaces provided at common use amenities, spaces that perhaps if you can rent out individual garages that are available to everybody in the complex and so forth. So there's a number of requirements in there. It's a little complicated. I think that gets at the question, correct?
Yes, thank you.
Oh, I'm sorry. I didn't mean to go ahead. I meant to keep going with the questions. We have time. Jason, more questions?
This is an interesting one. Are privately funded student housing facilities subject to requirements of the ADA? For example, it's a developer building student housing exclusively students for a specific university. So in this question, I don't think the developer is part of the university. It's just building university housing.
Dave?
That's an interesting one. And I would say that this is a question which Department of Justice as the enforcer would have the final say. And my suspicion is that their immediate response would be, it depends. And that we would need to look a little bit more closely at this kind of arrangement. Is there any kind of arrangement with the university or school or whichever one in the private sector that is functioning as the public accommodation? I think that in some scenarios where it's totally separate, it may not potentially be, but I think we'd have to look a little bit more closely at the situation, because certain factors could determine the answer one way or the other.
Rex, anything you want to pop up with, since most colleges and universities get federal funds?
Yeah, so I think definitely it could be, if they have received funding under 504, they'll have obligations. So if that's the case, it will be, that's one of those instances where you'll need to go back to who's giving you the money, if it's Department of Education as opposed to Housing and Urban Development. So it may make a little bit of a difference in how you apply it, but I think fundamentally it'll be pretty much along the lines that we've discussed. Also, it's very likely that fair housing will apply. Again, that kind of depends on the design units, whether multi-story or single family. I mean, multi-story single floor units. So yes, I wouldn't, I guess the short answer to this is that I wouldn't assume that you didn't have to do something. It's probably worth your time to investigate, and you may very well have some kind of obligation. Better safe than sorry on this one.
Next question.
So there's somebody that's attending behalf of supportive advocacy groups for people who use wheelchairs, and they have people all over Greater Boston who want to become more active, improving the availability of housing in their communities. And because the rules are very complex, they're wondering who can they turn to for guidance.
Okay, so well, are they in Boston, or is it the Boston
Greater
area?
Boston area.
Oh, the greater Boston area, because I was going to say the ADA coordinator for the city of Boston. Well, I'm glad to talk with anybody. I don't know if I'm the most knowledgeable person, but feel free to start with me and, kind of go from there. And in the resources, we'll have the phone number and an email address for the New England ADA Center. More questions?
If an existing building is undergoing an addition, do the units in the new portion of the building or the addition need to meet both Group 1 and Group 2A requirements for multifamily projects? Does the answer change if the addition is vertical, adding stories to the existing building, versus a horizontal addition that expands the building to include an extended foundation?
Okay.
Okay, so it depends. If there are more than 20 units in the building, the addition and the new building, and they are rental, all of the new portion of the building needs to meet Group 1, and then you would add all of the units in the building to determine whether you need any Group 2, assuming it's more than 30%, assuming the addition is more than 30% of the assessed value. So there's a lot of things that were left out of the question. Basically, are you spending more than 30%? How many units are in the project? And is it rental or for sale? And all of those answers depend on, all of those answers will depend on the answer to those questions.
And I think we have time for one more question, and then I'm going to move on to resources. And we are going to leave a little time at the beginning next week to go over, the other questions, and also some scenarios that I wanted to work through. But at this point, Jason, one more question.
Somebody's asking when new MAAB regulations will come out, and will they resolve discrepancies between MAAB and Section 504?
I really can't answer that. That's an AAB issue. I know they are trying to reconvene the subcommittee to go through the proposed changes. So I really don't know when they'll be coming out.
Okie doke. Thank you, guys. So here are some resources, and we're putting a link to the resources in chat, as well as a link to the form for people to get AIA credits, or if you want to receive a certificate of attendance. So Jason, I think you've put that in chat, yes?
Correct.
Yeah, okay. And the resources also have the regulations and some more information, the standards. I didn't want to mess up this slide with a whole bunch of stuff. Yeah, so there's a lot of information there. In terms of the slide deck, I didn't create a link for that, but I will create a link for that, and also for the 926 presentation. So if you want to hold on, we'll be putting that in chat at the end of the session next week. If you want to get it right away, you can email adainfo@ihcdesign.org, and I'll be glad to send you the presentation, or you can just wait till next week and I'll have a link to it. So I think that is all of our time. Thank you, everybody, for your questions and for your attention. I know it's very confusing, but I think from your questions, it seems like we have a lot of very knowledgeable folks on the webinar. So nice to meet all of you, and hope to see you all on the 26th. Bye-bye.